With me now is a physical therapist with LVHN Rehabilitation Services, Joshua Brennan, who is with us to discuss ergonomics and some tips to help us all work from home and stay a bit more pain-free. So welcome.
Hello.
So doctors have National Doctors Day, nurses have a week, but this is National Physical Therapy Month. So tell me a little bit more about what a physical therapist does and specifically your role here at LVHN.
Here at LVHN, I'm a physical therapist. We evaluate and treat patients with a number of different orthopedic, neurological, and vestibular issues. We create a plan of care with the appropriate modalities and exercise program to get them to overcome their impairments and disabilities.
So I use the word ergonomics. I'm not sure that everybody knows what that means. So tell me a little bit more about what ergonomics is.
Ergonomics is just a fancy way of saying easier work setup and use of how you are using your equipment that you use, whether it be a computer or if you work in like a factory or something like that.
Okay, because we're all spending a little bit more time at home now, right?
Correct.
So you'll give us some tips we'll talk about related to that. So how common do you see patients come in with neck and back pain from computer use, and really what causes that?
Neck and back pain is a fairly common diagnosis that we see. Studies show that there's a 15 to 35% chance of getting neck and back pain over a 6-month period of time with prolonged computer use. There's also retrospective studies out there that look back at the increase in neck and back pain in young adults over the past 10 years, and those statistics rose from 17 to 28%.
Wow.
And the study suggested that's because an overall increase in sedentary lifestyle and increased use of computers and electronics. Pain related to this is usually because we're in a poor posture for a prolonged period of time, and that makes more stress on those tissues that aren't used to where they're supposed to be.
So what are some tips that patients can use to improve their workstation or their posture or their sitting? You mentioned some of those things that cause the neck and back pain.
First, you want to look at your computer setup. You could start with your chair. So you want to make sure that your chair is at a good height. You want to make sure your feet are flat on the floor, and you want to make sure that your knees and your hips have about 120 to 90 degrees of flexion in them. So your thighs would be parallel to the floor and your lower leg would be perpendicular to the floor. You want to make sure you have a good back support in your chair. That helps with your natural curve and lordosis of your spine, which helps you good posture up the rest of the chain. You want to make sure your seat has a good width and depth for you. You want to look for about 2 inches between where the seat is and the back of your legs. Then you want to work your way up. You want to make sure your arms are at a good level, and you want to make sure that your keyboard's maybe about 1 inch above that. Moving on up to the monitor, you want to make sure that's at eye level, and then you want to make sure that it's about 20 to 30 inches away from you, and you can tilt it about 10 to 20 degrees upward so that you're not straining to look. All that being said, if your computer's set up right, your posture will kind of follow, but you want to make sure that you're sitting up tall, your shoulders and head are up and forward to where you're looking at, and you want to make sure that you're not twisting or turning, or everything that you need is close by you.
Okay, thank you. That was really helpful, starting at the bottom, working your way up to where the monitor is in the computer screen. So I know that sometimes people have different workstations, computer workstations, and some I've seen lately where you could stand while you're typing on the computer. So does that help you? Does that make a difference?
Standing desks are a newer trend going on. Statistics haven't showed really a significant difference in whether a sitting desk or standing desk is overall better for you long term. They're showing that they do have a different amount of health benefits as well as productivity benefits. Just like your sitting desk, you want to make sure you're standing in a good posture.
Okay.
Same setup where everything's kind of about right at the same levels, just that you're standing, feet even width apart, and then upright. Good thing about if you could have a desk that converts from sitting to standing, it leaves you the room to alternate your postures and positions throughout the day rather than being stuck in one position for a prolonged period of time.
Do you recommend that people take breaks at the computer and walk away, or maybe march in place or take a brisk walk?
Yeah, it's recommended that every 30 to 60 minutes you take a break from the computer and from what you're doing. You want to move around, you want to do some easy stretches. You kind of want to get your posture in the opposite of what you're doing, so you're kind of in that forward flex posture. So most of the exercises and easy stretches that you could do are to reverse that, So easy back bends, squeezing your shoulders back, rolling your shoulders back, just to kind of reverse the tension that's on those tissues.
So you mentioned some simple stretches that you can perform. Can you talk a little bit more about that?
So kind of just went over them, everything we're trying to do, and after you're in that prolonged position, try to get you out of it. So if you can go backwards and then hold for about 10 seconds, same thing with your shoulders, squeeze them backwards, roll your shoulders backwards. It kind of resets those tissues and lets you be able to kind of reset everything and make you not in that pain or prolonged position for a long time.
So we're in one of our rehab centers here in Tobyhanna. So tell us a little bit about some of the equipment or our aquatherapy that we have available here.
So here we treat a wide variety of diagnoses, like I was saying before. We have a different amount of equipment here, whether it be to strengthen things up. We also have the pool. If you can't tolerate a land-based therapy, it's usually easier on your joints because you're more buoyant in the water. So there's different things that we could try based on what's going on. We try to focus in on your impairments, see what's causing you to have pain, weakness, and then we work on coming up with the best plan and using the appropriate equipment that we have here.
So early on you mentioned vestibular. Can you talk a little bit about that and what that means?
Vestibular therapy is usually people refer to it as balance or vertigo. A lot of times they'll come in with different diagnoses, whether it be a more systemic problem or a more peripheral problem. We can treat it here. A lot of times people don't really think of physical therapy helping dizziness or balance, but there's different treatments that we can do here to kind of decrease some of those symptoms, especially if you're getting it coming into different positions, where if you're sitting and then lying down, that's a treatment that we use here that normally helps with that dizziness.
Okay, thank you. So my sister's been working from home a lot. She has back pain, so I'm definitely going to ask her to watch this segment. And I really appreciate your time and thank you for sharing these wonderful tips with us.